Friday, 27th March 2020, there will be a daily curfew from 7 p.m. to 5 a.m. in the morning.
With healthcare workers of different cadres still on strike, the public healthcare sector is deteriorating by the day.
We start this bulletin with a warning from the government that you may not get a hospital bed in Nairobi as all are occupied.
An oxygen crisis in the country continues to bite, and patients are losing their lives while in search of this precious commodity.
While most economies in the world shrunk, Kenya's economy grew at 0.3 during the 2020 period, despite the COVID challenge.
The COVID-19 pandemic opened the floodgates for looting of funds allocated for medical supplies.
This building here has got its fair share of criminals.
Already the information reaching us is that some counties clearly don't seem to be accounting properly for their COVID funds.
Yani corona imeleta umaskini, ni kama ni shetani alikuja akagandamiza watu, ule umaskini ukaongezeka zaidi.
I'm a salesperson by profession, but since corona iliharibu kazi yangu kabisa. Niko karibu kufika ile stage ya kusema hii maisha hata afadhali nichitoe uhai.
Mtu hasla ikianaambiwa anunue mkati 70. Utatoa wapi 70 bob ya maziwa yenyewe upati?
The first relaying of information was that we'll give food to people. So people expect food. But then government changed tactics in between, I think, when they felt the logistical nightmare of distributing food, and they were now distributing money. So then you don't make people wait for food, yet you have changed to money and you have not told them money is coming. Yeah. So, and then the level of transparency of those processes.
Mzazi kujukumika ununue uniform hauwezi, kwa sababu unang'ang'ana na mambo ya karo. Sasa yale mambo ya fi watoto wamekuwa sasa wanaenda shule wakiwa kama hawana zile sare za kawaida, wanaungua.
Na unakuta kwa mwaka unalipa 40,000 kwa zile shule ambazo ni national schools. 40,000 inakuwa ngumu, tamu zikuwa ni ngapi? Ni 3. Inakuwa ni ngumu kupata kurezi hizo pesa.
We've also seen how parents are being stressed in terms of paying school fees for their children, catering for those needs, because these terms now had to be condensed so that the children could be able to finish school in time, and this has been a very big burden for the parents.
As March came and COVID came, that's when there was really an uproar and an outcry of the teenage mothers. These girls and boys were at home. That's when these things happened. They are the cases of defilement that also most of them happened during COVID, when people were at home.
Wale watu ambao walipata mimba watoto wengi hawakurudi shule, including even wale wa secondary pia hawajarudi shule.
And most of the children involved in drugs, when they came back, they were a bit wild. We had to guide and counsel them so that they could come back to their normal.
So during the COVID period, we saw the closure of schools. Children were home for almost a year. So there was a very sharp increase in the number of teenage pregnancies, and we also saw rising cases of sexual and gender-based violence, an increase in the number of girls who are being defiled, rape cases, and also domestic violence within the families. This could have been attributed to issues of depression, issues of frustration, as most people lost their jobs during the COVID period.
We avoided crowding. Every area that we had where children were to crowd, we had to reduce the number. We also created some extra rooms for learners to be divided in different areas.
during COVID era, most of the services were affected.
Sasa sisi wagonjwa wengine wenye tulikuwa tumeumia tu kwa tunapata usaidizi wowote, tulikuwa tumeachwa. Juu sasa ilikuwa watu wanapanga laini wenye wanaingia lazima wafanyiwe testings. Hata wards tulikuwa kama tuko peke yetu bila madaktari. So wakati huo wote tulikuwa kama tumehangaika. Hata hiyo hospitali hata kupata hata Panadol hivyo na painkiller tulikuwa tunapata. So ikabidi wengi tukatoka tukaenda nyumbani.
Due to the fear of contracting COVID-19, people with chronic diseases such as diabetes, hypertension, HIV were really avoiding to go to the hospitals. This saw also an increase in deaths, which could have easily been prevented if these members were going to the hospitals for treatment. Perhaps this could have been because of the myths and lack of understanding in terms of what COVID-19 was for the community members.
My bones are weak. I have a condition known as osteoporosis, where bones become weak and brittle. Okay, nilienda hospitali, nikaambiwa, unaona nilienda wakati wa holiday, nikaambiwa madaktari wanaenda holiday. Na sasa hiyo ugonjwa yako haijui kwa ni holiday ama ni nini. Nilienda assessment, nikaambiwa niache barua huko, wataituma. Hiyo barua kwenda kuangaliwa, hakuna barua. So services zangu zikadelay.
Issues to do with the non-communicable diseases. Routinely in our hospital setups, we usually screen these patients whenever they come, day in, day out. And in that respect, the entry of COVID-19, it really disrupted these services severely, and we had to adjust. We had to adjust accordingly so that we can counter this COVID-19. The issue of maternal care, it was also one of the services which was really affected by COVID-19. For perinatal mothers, they usually have visits. That is around every 4 weeks, they come to the facility. Generally, the progress of the mother to delivery. But now, because of this pandemic and some of the restrictions which were put by the government, we were not able to achieve that turnout of these mothers. Therefore, the number of visits got reduced.
Mimi kama community health worker tulikuwa na mambo mingi kwa sababu watu wale walikuwa wanakunywa madawa walikuwa na shida mingi sana. Lakini ile shida kubwa tulikuwa naye, tulikuwa na dawa zilikuwa zinakosekana kama septin, therapy ya watoto na dawa zingine kama opportunity diseases.
We've also seen a laxity among our government officials in terms of service delivery. There was a directive of working from home. So in most cases, when community members would go to these offices, they would not get anyone in those offices. And these government officials were hiding behind that policy of working from home. We also saw funds being diverted from county budgets to cater for the COVID issues. So critical services such as health, especially the reproductive health sector, was very affected as mothers could not be able to access family planning contraceptives, and this money were diverted to address COVID-19, which was an emerging issue at that time. Despite all these negative consequences, I think there was an improvement in terms of hygiene, as now people were getting used to washing their hands and being in clean environments, sneezing while closing your mouth just to prevent infection. And now it has become a habit for them. So at least there was improved hygienic practices among the community members.